Welcome back to Living 808. Cervical cancer was once one of the most common causes of cancer death for American women. But over the last 50 years, the cervical cancer death rate has gone down by more than 50%. Much of the success is due to growing education among women. Now, January is Cervical Health Awareness Month, and here to help us keep up the good fight is Dr. Christina Spears, a radiation oncologist with the Cancer Center of Hawaii. Hello, doctor. Thanks for joining us.
Thank you for having me.
Cervical cancer, we hear a lot about that. It's pretty common, right, out there.
Yes.
Tell us what the risk factors are.
Sure. First of all, the cervix, for those not familiar, is the opening to the uterus and sits at the top of the vagina. Cervical cancer is more of a worldwide issue because the risk is so drastically decreased with pap smear screening. So because, as you just indicated, pap smear screening here is fairly widespread, most women can avoid having cervical cancer in their lifetime. In fact, 50% of patients that have cervical cancer have never been screened before. So that, by and large, is the best way to decrease your risk. But regarding risk, the risk factors include early age at sexual intercourse, number of partners, number of pregnancies, smoking, and immunosuppression from HIV infection or prior organ transplant. So if you have any of those risk factors and if you've never been screened, I recommend you be referred to a gynecologist to start screening.
How often should you, or at what age should you start getting screened? And I remember being told a few years ago that now my pap smear appointments can be, you know, I don't know how many years it is now.
It's 5 years now.
5 years,
so
okay.
The ACOG, or the American College of Obstetricians and Gynecologists, recommends starting screening at 21 years old, no matter when you become sexually active. And from 21 to 30, you get your pap smear every 3 years. And then from 30 and above up to 65, you get your pap smear every 3 years as you have been, or you switch to every 5 years with a pap smear and HPV testing. HPV is the human papillomavirus, and that's thought to be the most common cause of cervical cancer.
Okay, so I just made it. I just turned 31. And then I hear that there's a vaccine for cervical cancer.
Yes. You know, the CDC, or the Centers of Disease Control and Prevention, say that 75% of the reproductive population has been exposed to HPV. And most people think that number is probably a lot higher. So Gardasil is a vaccine that targets 70% of the subtypes that cause cervical cancer and 90% of the subtypes that cause genital warts, and can increase your risk of anal and penile cancers potentially long term. So the FDA has approved Gardasil use in girls from 9 years old to women up to 26 years old, but most pediatricians recommend thinking about vaccination when girls are 11 to 12 years old. And there's currently studies about whether this would be beneficial in boys or men as well.
Okay, wow. I need to go and look into that. So there is the vaccine.
Yes.
And if someone is diagnosed with cervical cancer, how is that treated?
So the first place to start is usually a referral from their gynecologist to a gynecologist oncologist. There are surgeons that also treat patients with chemotherapy as needed for gynecological cancers. And then if radiation is indicated, they will refer the patient to us for consideration. But generally it can be, depending on the extent of disease, it can be as simple as surgery alone, or it can be chemotherapy and radiation. So it depends on the stage of disease.
Would you say this is one of the more treatable cancers?
If caught early, it can be very treatable, but if it spreads to other areas in the body, it can be harder and harder to treat. So early detection is key.
Okay, and that really is the message, I think, with all cancers.
Oh,
right?
absolutely, absolutely.
Yeah, pay attention to your body and get the various screening, right, being offered.
Yes.
Doctor, thank you so much.
Thank you for having me.
See you again. We are going to have much more on Living 808 when we come back. Stay with us.